me on Sunday afternoon for my Sunday Facebook conversation, but it was Father's Day. So I decided to take a day off and spend it with the family and the kids in the backyard with a little barbecue and just a lot of relaxation. It was just what these three doctors here ordered for me to do. I am looking forward to a great conversation with my guests here tonight. I have three well-trained, highly educated doctors, psychiatrists. We're going to talk about mental health, and it's extremely important right now in the midst of two crises. The first crisis, of course, is the global health pandemic, where we've all had to deal with living under stay-at-home orders and the stress of working from home and teaching from home and the many things that make life stressful while all working and staying at home. And then, of course, we had yet another unarmed African-American killed in this country at the hands of a police officer, which has led to a lot of civil unrest in our country. It's also led to a lot of people being very blatant about racism. So we're going to have some tough conversations here tonight. Buckle up for the next half hour or so, and let's pluck these doctors' brains for their knowledge and wisdom. And if you have questions, feel free to type them in the comment box. We'll try to get to those, as many of those as possible. But first, we're going to ask these fine doctors to tell us a little bit about themselves. And please, before they do that, share this feed so that your friends, if they're not friends with me, can receive this information here tonight, because it promises to be a good 30 minutes of great information. So we're going to start with Dr. Conde. Doctor, how are you?
Good. How are you?
Welcome. Tell us a little bit about yourself.
All right. Hey, everyone. My name's Chandan. I am a psychiatrist at UIC Hospital in Chicago. I actually grew up in Aurora, not Naperville, in the western suburbs. Went to high school in the area, went away for undergrad and med school, and came back and did my psychiatry residency at Northwestern. So strong ties to Illinois, best state in the union.
Dr. Adrienne Adams is joining us tonight. You want to tell us a little bit about yourself, Doc?
Sure. Hi, I'm originally from Detroit, Michigan. I went to medical school, Wayne State, so I have to say Michigan might be, no. I love Illinois too. I moved here in 1997, and I did my residency and fellowship at University of Illinois at Chicago. And I've been working at Rush since 2005, where I work with children and adolescents for, last 17 years.
Wow. And Dr. Danielle Jackson, want to share a little bit about yourself?
Sure. Hi, everyone. My name is Dr. Jackson. I am originally from the East Coast. I went to medical school at Howard University College of Medicine and am in the process now of completing my general psychiatry residency training. I'm a resident currently at Northwestern University, and I'll be finishing up my training actually on the East Coast at Yale, doing some specialized work in addiction and social justice and health equity.
Wow, Yale. You're headed there soon, I hear. Dr.
Pardon?
Jackson, I hear you're headed to Yale pretty soon here.
Yeah.
Well, congratulations.
Yeah, in a few weeks.
Wow, congratulations. It's got to be a busy time for you. Why don't we jump right to it then? Let's talk about everyone's emotional health and their behavioral health. And let's do like a round robin here first. And what sort of emotional or behavioral problems do psychiatrists, doctors like yourself, see during a pandemic? Let's start with the pandemic, because we can spend probably a show on each one of these crises alone. But what types of problems do you see just from the pandemic, Dr. Conde?
So a pandemic is a huge social event that affects everybody. But what we know from psychiatry is that people deal with stress in different ways. We're seeing a lot of depression. people just feeling sad, alone, isolated, worthless because of the effects of the pandemic is having on them. A lot of people dealing with an anxiety, either just generalized anxiety all the time, having panic, having some of their fears and obsessions act up. And then we also know that people who suffer from serious mental illnesses like schizophrenia and bipolar disorder, people with autism and intellectual disability, the lack of structure that's been caused by the pandemic, like the closure of schools, businesses, community resources, has had a huge destabilizing effect. So everybody's not doing well, but the way they're not doing well really varies from person to person.
Dr. Adams, what types of things have you seen during the pandemic?
Yeah, I would say similar things. We work with a lot of autism kids as well. So I would say for our autism kids, has especially been difficult. Increased anxiety, but a lot of times they have difficulty with expressing it as anxiety. So we might see more aggression, irritability, some sadness. We definitely, like one of our little guys, he packs up his backpack every day and he's waiting at the window looking for the bus. But of course, there's no bus because due to the pandemic and with the stay-at-home order, we had to do homeschooling. So I know for a lot of our kids, they had difficulty with converting over to doing online schooling. I would say for some of our kids, they did okay, but overall, social engagement and structure are really the mainstays for child psychiatry. So I would say, been a significant impact.
Dr. Jackson, we're talking about the types of emotional and behavioral problems people have experienced during the pandemic. What types of issues have you seen pop up? Dr. Jackson, can you hear me?
I'm sorry, my connection is a little low. Were you asking me a question?
Yes. What types of issues have you seen or had to address during the pandemic? We're having connection issues with Dr. Jackson. She's going to come back and rejoin us with a new connection. But let me ask you too, Dr. Adams, does everyone who need help find a counselor or psychiatrist?
Oh, no. Yeah, and we can definitely not. Unfortunately, as you probably have heard this, and typically this is something that we go to DC for each year for advocacy, as well as we go to Springfield each year. But we are totally underserved for child adolescent psychiatrists as well as other clinicians for kids. So, I know that they said the median age for a child psychiatrist is roughly about 54 years of age. So a lot of our specialty trained psychiatrists that work with children and adolescents, they're actually aging out. We don't have enough people coming in. So we have a huge demand with a lower supply of child adolescent psychiatrists. So that's one thing. I could show you a map, and I wish I had brought it with me, of all the counties, even in Illinois, that do not have access to a child adolescent psychiatrist. Some of the things we have been trying to work on has been collaborative care, which is something that we've been looking to kind of spread out the wealth as far as for areas, rural areas, as well as urban areas that don't have access to a child psychiatrist readily for the collaborative care model. But of course, we're still held up with funding, bills being passed over the state for that. So, no.
Dr. Conde, I saw you shaking your head pretty emphatically there. You say everyone doesn't look for help. Why is that? Why is it hard to find?
I think a lot of people are looking for help, but they just can't. And just to add some historical context, what Dr. Adams has been talking about. We're seeing the end result of a decades-long systemic dismantling of the mental health and substance treatment system in the United States and in Illinois. So already the system's hanging by a thread. Clinics are closing down in neighborhoods that need them the most, especially in underserved urban areas and rural areas. And so the system was already in danger of collapsing all by itself. And then a pandemic happens, and that's the final straw that breaks the camel's back. So if people had before a 6 to 9 month wait list to see a psychiatrist or therapist, now it's just on hold indefinitely. And you can bet that this disproportionately impacts communities of color, socioeconomically disadvantaged populations, rural populations, women, children, and the elderly.
Mm-hmm.
So you're seeing here really a confluence of both a natural-made virus and a man-made disregard for mental health.
So listening to you carefully, who are the people that are most in need of mental health care?
So I would say that most people are in need of mental health some point or another, but especially people who are already the disenfranchised in society. People already have to deal with additional societal stressors that most of us never really have to think about, like poverty, lack of education, unemployment, lack of access to resources. For example, if you look at African American Latino populations that have been brutalized by, among other things, police brutality, but also just the casual racism of institutions, neighborhoods that have been redlined.
Dr. Adams, I see you shaking your head a lot. I mean, do you have to believe in counseling to use it?
You know, I think a lot of times if you can just make that first step, I mean, we definitely get kids or even parents at times that are saying, you know, we're here because the school referred us, but I don't really know if I believe in it. But I think it's kind of providing psychoeducation, kind of explaining the purpose of counseling, what our goals are. We're not there to make a perfect person or have someone lose their personality, but more so help their functioning, or if they're dealing with stress, helping them use positive coping strategies. So yeah, I agree. I would say everyone should get a therapist. But honestly, though, there have been studies that have shown that people of color typically are dealing with a lot more discrimination. And they've shown that discrimination actually has had an impact both on your mental health as well as physically. We're more likely to get hypertension, diabetes, as well as depression, anxiety, PTSD, substance use, all from systemic and institutionalized racism.
You know, a lot of people don't know that psychiatrists like yourselves are medical doctors. You're doctors, and not everyone seeks the help that they need because they feel like they can't afford it. Dr. Conde, you talked about poverty. You know, if someone was going through the pandemic and felt like they couldn't afford your services, what could they do if they needed mental health services?
So that's a really good question, because a lot of times the people who are in most in need of services, they say, are the ones least able to afford it or access it. And part of the issue of that is because Medicaid reimbursement for psychiatry is historically low. And again, because systems refuse to fund this, it makes it even harder for people to get. So what I recommend to people is at least talk with your family, develop your own local systems of care, develop a community for yourself, and talk to a general doctor, because oftentimes PCPs or primary care physicians, you may not be able to see a psychiatrist, but they can talk with one of their psychiatrist colleagues for like an informal consultation, like, hey, my person is having some issues with depression. Do you recommend anything we can do to help them? And oftentimes, even if you can't see a psychiatrist directly, you can see somebody indirectly through your healthcare system.
Dr. Jackson, welcome back. Can you hear me okay?
Yes, I can hear you okay now. My apologies.
You know, we've been talking for the most part about the global health pandemic, but let me kind of use your entry back onto the panel to shift gears to the George Floyd murder. Everyone in the world saw the George Floyd murder in the 8 minutes and 46 seconds that Minneapolis officer had his knee on George's neck. And they saw it, many of them, over and over and over again. And as a result, I think it led to a lot of the anger and that people felt that led to the civil unrest in this country. What have you seen in your practice as a result of the George Floyd murder? Dr. Jackson? Dr. Adams, you want to take that question?
Okay, sure. Well, typically, you know, I would say a lot of people are suffering.
Right. Can you hear me?
Oh, okay. I thought she was back. I'm sorry. Yeah. So typically, seeing that image was, I would say, across the world was really had so much of an impact. I mean, I know on a lot of people that it can trigger, I would say, PTSD, post-traumatic stress disorder. I know that a lot of anxiety. I've talked to some of my friends as well as some of our kids that have talked about it, and it was pretty stressful. It's upsetting. It's scary. I mean, there's a whole range of emotions, but fear, at worrying about will it happen to me or another loved one? Because I mean, typically, unfortunately, in a lot of our Black and Brown communities, you do worry about something like that happening. You worry about something like that happening to your own son or your own nephew or your own grandson. So, I mean, this is a very real thing. And, and I guess the big thing is it's not new. This type of violence has always gone on. I think the bigger thing is now that we all have nice iPhones, we're able to actually record things so that the world can actually see all the brutality and horrible things that have happened to people of color.
Dr. Conde, you're over at the University of Illinois, Chicago. Pretty accessible to folks. What have you seen as a result of the George Floyd murder? Have you seen an uptick in folks that you've seen as a result of racial tensions in the country?
So I think that in my job at UIC, I see people with psychiatric concerns who are in the general medical hospital. Like they've been admitted for a heart attack, pneumonia, COVID-19, like trance and so on. And so we often get called because, oh, this person's looking depressed or anxious in the hospital. And a lot of times people are just depressed or anxious because they're in a hospital. Like nobody wants to be in a hospital if they can avoid it. But especially in our marginalized population that we're seeing, this is just yet another thing that's on their mind. Like they already had concerns, pandemics made everything worse, and then this on top of that has just added to their stress. So I'm actually training my medical students and residents now to ask people just upfront, like, hey, how have you been doing? And I said, how has COVID-19 been impacting you? And how have the George Floyd protests been affecting you? And people are responding different ways. Like one patient I saw just earlier today, she is pregnant, stuck at home, unemployed with her boyfriend. And because of the protest, she's not able to access groceries like she can before. So she's in a mix of emotions of, I'm upset that this incident happened. I'm upset that now I can't access groceries to like feed, like myself and my baby. And people often don't know like what to feel. It's just so much to go on. And then now you put on top of that being stuck in a hospital, like who can you talk to? Most hospitals now, you can't have visitors because of social distancing. So what we're finding a lot is people are feeling scared and angry and all the emotions Dr. Adams talked about, but they're now just, in addition to that, feeling alone in those feelings.
I am talking with Dr. Chandan Conde and Dr. Adrienne Adams about mental health, and we're dealing with it both in the context of the global health pandemic that we're living in, and in this period of civil unrest in our country and right here in our own state. Please feel free to share this conversation with your friends so that they can pick up this helpful information. I have been enlightened, and I want to welcome a number of people who are watching. My friend Denise Wang Stoneback has joined us, and say thank you for hosting this important conversation. Thanks, Denise, for joining us tonight. Amanda Chelsea Bleka, thanks for hosting. Excellent panel. So she's enjoying what you guys have to say here tonight. I got to tell you, if you are not one of the people who has taken a break from social media during this time, and I have not, I do use social media to get out information. I do post my personal opinions, but I put out a lot of information. And you see the wide range of comments on the issues of race. And the rhetoric is extremely harsh. And as a Black man in America who has experienced racism, and seen it, experienced it, it's real. But there are people that just blatantly think just because you say Black Lives Matter, you're pulling the race card. Just because you're sharing your experiences, you're making things up. The discourse has just gotten so harsh. So Dr. Adams, I want to ask you, how can a counselor from a different community understand life under racism? And then Dr. Conde, I'm going to ask you that question as well.
Okay. Well, I think the biggest thing is really just to listen. I think a lot of times we all have our opinions about what to do, but I think the bigger thing for someone, if you're not familiar with what's really going on, is to really listen to that patient and kind of see where they're coming from. And I would say also be open to possibly some of the things that are said. I mean, talking about racism is hard. I mean, no one wants to hear it. No one wants to feel like they're a racist. But I mean, sometimes maybe everyone has some unconscious bias. Everyone has they're a little biased, and that's just part of human nature. But I think being open that, yes, there are some things that you can improve on. And yes, you should kind of listen to other experiences that maybe you haven't experienced, but doesn't mean it's not happening.
Dr. Conde?
A lot of books as well. I was going to say what you probably heard of this one, The Right Fragility, that book. But I think a lot of our white coworkers and non-brown and black coworkers should read it. I think it's helpful to kind of get a better understanding.
Dr. Conde?
I think a lot of it's just a willingness to admit you don't know. I think especially in our current political discourse and with some of the leadership that we have in government, there's this idea that the more confidently I shout something, the more I know about it. But we just have to be willing to say, I don't know what it's like. Like, as an example, during residency, I had a Black male patient I saw for weekly psychotherapy. He had a lot of depression, but also just a lot of anger. And I was trying to separate out like how much of the anger is just him as a person and his issues, and how much of it was just being a Black man in Chicago and having to go through things he said. And I think one of the best compliments I ever got was towards the end of our time together. He was like, Dr. K, like, you get it. And I was like, his name, like, I'm not Black though. It's like, you're close enough. And so I don't, not to make light of it, but I think when you learn to appreciate like what you don't know and just absorb it versus just being like, no, that's not true. Like, oh, I saw on the news or something else. Like, who are you to say that this person's existence isn't what it is? Like, Representative Welch, you know your life better than I know your life. So who am I to tell you that, no, this isn't what your life is like? So I think having a little bit of humility and curiosity goes a long way.
We have a guest, Betsy Mitchell, is appreciative of the focus on this issue tonight. Thank you, Betsy, for joining us. I want to go to a question here, put it on the screen, from Vicki Lynn. With talk of defunding the police in some areas and replacing them in some instances with social workers, do the doctors on this panel think this is possible? How do they think it may work or not work? I have my thoughts on police in schools. I have filed several pieces of legislation with regard to police in schools, and I don't think there's a place for them in schools. But that's a different topic. The question that Vicki Lynn asked, what's your thoughts on that, Dr. Conde? We'll start with you and then Dr. Adams.
I think it should at least be explored. Now, full disclosure, I am actually involved with the Chicago Police Department. I'm on the work group overviewing their crisis intervention training, or CIT, which is a training that a lot of police departments, including CPD, have their officers go through to be better mental health allies and supports in the community. But we all admit that that has limitations, and police barely have enough time to be police versus also social workers and counselors and all the other things that need to be done. So if there is a way that some of the work that they do right now could be offloaded to social workers who just have more training and expertise in this matters, I think not only would it save police some time, but it would just make society function more smoothly, because the experts in social work, the social workers, are now doing the actual work.
Dr.
Yeah, I think I want to start with the term of underfund, because I think that term can be kind of scary unless you really know what it means. And actually, if you read through the underfund, that really means like massive reforms, which, yes, I am totally in favor of massive police reforms. I definitely think that we need to have more training for our police officers. I mean, there are definitely some good ones out there. So, but I think more training as far as with cultural issues, more training as far as sensitivity, more training on how to interact with people with mental illnesses. I also think that we need to work towards more of primary prevention. So instead of building more prisons, actually build more after-school centers. I've always felt that even as a kid that I wish I had a lot of money, because then I would buy a whole bunch of after-school centers for kids. But I think that's been the biggest thing. I think we've spent as a country so much money on building these huge prisons that they're making so much money, from what I understand. But I think, hey, let's use that money, invest in education so that we can all have people that are taking advantage and doing great things, but also more support for our families. So I would say, yes, I would like to use a reform so that we can maybe have more social workers, but also have more of the after school programming, have more, I would say, instead of everyone going to college, even have more, trades. I think we need to invest in our youth. That's the biggest thing.
When I hear the term defund the police, I know what the folks mean by it. I wish they would use a different term. I do think that we're in a watershed moment in history where policymakers like myself, we're actually going to be able to get something done with regard to police reform and police accountability. But the term defund the police, I think, will scare away some people who want to vote on these important issues. I think what they're saying is, let's reallocate the resources. Let's put more money in social workers, and let's put more money in after-school programs, like you're saying, Doc. But when you say things like defund the police, you're getting folks all worked up for no reason. And I think we have to be very mindful of our rhetoric in this debate. We only have about 3 minutes left, and we do have a couple more questions, but I wanted to show a comment to you on the screen from Cynthia Given. She's a great follower of mine from downstate Illinois, and she's watching this from downstate, which she says is a mental health desert. And thank you for having this important conversation. So I want to thank Cynthia for watching this important conversation, and all of those who are tuned in tonight listening to this, because this is extremely helpful. And it leads me to this question, Dr. Conde. What are some social determinants of health? I mean, what if you're living in an area that is a mental health desert?
Well, I think if you're living in an area of that's a mental health desert, you don't have access to psychiatrists, you don't have access to therapists, and even if some physically live in the area, if they don't accept your insurance, or if insurance won't pay them to work with you, then you're out of luck. And so basically you have all the same stress that anybody else in society does, but you don't have access to the same resources that somebody in a different socioeconomic class, or even just a different zip code, will have access to. So already that's just built-in inequality in the system. And we're big on America about equality and freedom for all. But if we're setting people already at a disadvantage in the race, how can we expect people to be able to finish?
Dr. Adams, with telehealth, and during the stay-at-home orders, the governor placed a real big emphasis on telehealth. I mean, does that help us in this situation where there's deserts in parts of the state?
I feel like it has been helping. I think with the telehealth, we've been able to reach out to more patients that normally might not be able to actually come into the facility anyway. So I think it has been helpful, both with the ability to do video as well as telephone. The only, I guess, big concern is we've been able to reach out more, but I know that this is like a temporary bill from what I'm understanding. So there's always the threat that at some point our state will, stop it, and then we have to go back to business as usual, which then I think is going to be very unfortunate for a lot of our patients and people that wanted to get treatment that are in that desert. So I think once again, it's advocacy and really trying to make sure that we're letting our voices be heard, that this is important.
Well, I hate that we missed Dr. Danielle Jackson tonight with the technical issues. I know she's just moved into a new apartment and got a lot going on with her transition over to Yale. But you guys have been great. Any final comments from both of you? Dr. Conde, I'll start with you, and Dr. Adams, I'll give you the final word. Dr. Conde.
So I think COVID-19 and the George Floyd protests have been a huge stress on society and all of us, but it's also been a rare opportunity to shine a spotlight on all the dark corners of America that we have not been paying attention to. So I really hope that people can look at this as the opportunities to really make meaningful change, not just on an emergency basis, not just for the next like 6 months or so, but for the rest of our time together. Because if there's one thing that we all are, it's tired. We're tired of business as usual. And if we can work together, find ways to make tomorrow just better, then even the next time that a global pandemic hits or the next crisis occurs, we can be better prepared for it than we were this time.
Dr. Adams?
Yeah, I agree. I totally concur with what you're saying. But and also I think I think everyone should be an advocate. Everyone should get out there and make their voices be heard. But also I think you need to make sure you're taking care of yourself. So, check with your insurance or your local mental health clinic or academic facility, because I'm at Rush, we always have our doors open, to also make sure you're taking care of yourself, because if you can't take care of yourself, it's harder to take care of the wider society.
Well, I appreciate both of you for taking time out of your busy schedule, probably right before your dinner, to join us for this important conversation. Also, I want to mention that Dr. Susan Scherer is going to send us some resource information that we can share with those who are interested. So please, if you have questions, go to my social media at Rep. Chris Welch on Facebook, Instagram, Twitter, or email me at repwelch@emmanuelchriswelch.com, and we will get that information out to you as soon as they share it with us. They have been great, and I am very appreciative of them. Join me again for my next Facebook Live conversation on Sunday at 3 p.m. when I return to my Sunday conversation. I will be with the Illinois State Police Director, Brendan Kelly, and we will be talking about police training and things of that nature with the head of the Illinois State Police Department. I'm looking forward to that conversation. I'm sure it's just going to be as enlightening as what we just had with these two fine doctors. Thank you all, and have a great evening.
Thank you.
Thank you.
Thank you. Wow, that was fast.